today the lecture is about 1000 shots technique with ultra-former MPT. Well, currently I'm enrolled in the Pixel Plastic Surgery Clinic right now, and I have used maybe 15,000 shots a day, only with this ultra-former MPT. This is due to the fast treatment time, and it is really popular in South Korea right now. So maybe 15,000 shots to 20,000 shots a day with this ultra-former MPT, and 6,000 shots with VT or Volnewmer. So I'm going to introduce this ultra-former MPT and Volnewmer together today. Alright, let's get started. Alright, perfect. So this is table of contents. So we're gonna start with why have we used the HIFU machine to fight against the aging, and then why it has to be ultra-former MPT among many devices. After that, we will shortly see the clinical experiences. Sorry about this. I'm not pressing it that time. Alright, so I'm going to share the clinical cases, and then we will introduce the Volnewmer to you too. Alright, so why have we used HIFU machine to fight against the anti-aging and for our patients? So after I got the request from the company classes, I have prepared 5 new models only for this class. So when you see those patients into your clinic and confront them, what do you think of them? What would be the first option for them? Is there anything comes up on your mind? Alright, so as we get aged, the skin gets thinner. Fascia, retaining ligaments, muscle layer, all gets weaker. There will be a change in fibrous tissues, and there will be a disorganization in collagen also. So this is why HIFU worked as a rejuvenation tool. To fix all those problems, our doctors have used HIFU for the patients. We restored the collagen. We tightened up the skin. We try to get rid of all the fats that patients do not want, so make them look younger. So let's see this cross section. So as we get aged, there is collagen atrophy, elastin will be destroyed, and what are we going to do? As we can see, we have used this HIFU machine to make a high intensity focal region on the cosmetic depths of the skin layer. And then, after a month later, we will see the restored new collagen here. Alright, so the target temperature will be 65 to 75 degrees Celsius. And what happened on that temperature? Because collagen denaturation, and this is the optimal temperature for the neocollagenesis. So hypothermia, coagulation, collagen constriction, ablation happens when we use this HIFU machine into the focal depth, making a focal region on the cosmetic depths of the skin. So right after the treatment, the inflammatory phase starts. So it will bring us a control of blood flow and making a new cells. So after 40 hours, maximum to 6 months, we're gonna get a result, getting a new collagen and making a patient look younger. So if we see this histological evaluation, it shows that after 30 days of HIFU treatment, we can see that there is more elastin fibers made up due to the HIFU machine. Not only elastins, we can see the type 1 collagen growing up compared to the pre-treatment. After 30 days, it is proven. While the elastin fibers and collagen fibers has grown up, increased after the treatment, we can tell that there's less like yellow lines, right? Yellow dots. Those are the fats. So recently, not only just lifting the smooth layer, a lot of patients want to get rid of the fats they don't want on their face. So they think they can look younger, healthier, look like a K-pop idol or some actors in Netflix. So actually, the fat ablation effect is really great for HIFU. This also shows that papillary dermis area and reticular dermis area has gotten thicker after the HIFU treatments. All right. So we all know, and we briefly saw why we have used HIFU and how HIFU works. And why does it have to be ultra-former MPT? not the other machines. Ultra-Reformer MPT has 3 key features. First, they invented the MP mode and normal mode. We can choose between both of them. On the top of that, not only the bar type transducer, we do have a booster now. So we have a pen type booster, which can be really advantageous when we go over the curvy area of the face. For the last thing, the pain and time is really short and really low. So I have seen many cases. I see at least 50 patients a day, only for Ultra-Reformer 1 day. They don't feel any pain. So numbing cream is okay for this. As you can see, we are making a precise TCP with the normal mode. However, we are making a wide area with the MP mode, making a bulk and wide area of thermal effects. On the top of that, not only the bar type transducer, the booster type also can make this dot line on the TCP, precise TCP. However, it also has MP mode, making a circular MP TCP lines. So the MP mode, what is really good about this is that it is really effective for melting fats, because compared to the normal mode, we have a wider area of thermal coagulation area, which makes the fat to melt down much effectively compared to the normal mode that Ultra-Reformer 3 had. And the second feature of the Ultra-Reformer MPT is the booster cartilage. Let's guess which one is my favorite. Green one, yellow one, blue one. The green one is my favorite because this depth is the only that booster has 1.5 millimeter. Really effective for narrow and curvy area of the face. So we do got cartilages of pen type. The great thing about this is that we can use the DSP ampoule with pen type boosters. DSP ampoule contains a lot of things like glutathione, niacinamide, PDRN, everything that can brighten up and tone up the skin of the patient. Because the pen type transducer has a great effect as an ultrasonic vibrator, the ampoule can go into and penetrate this patient's skin. So the patient's skin gets toned up and brightened up. You will be really surprised once you start using Ultra-Reformer MPT with DSP ampoule. So this data demonstrates that there's only advantage things about the booster pens and the DSP ampoule. It got really helped the patients with the fine wrinkles and colorization, hyperpigmentation. It also hydrated patient's skin a lot. However, there is no adverse effect. Important. Alright, so the last thing, but really important thing is that as we came from Ultra-Reformer 3 to the Ultra-Reformer MPT, the transducer got really light. So my hand doesn't get tired. So when we had this machine, maybe like 5 years ago in Korea, like all doctors were like being tired after reusing it because we've seen many patients every day. However, after it got changed to the MPT machine, our hands doesn't get tired. And patients really like the result and the shortened time of the treatments. They feel less pain and they don't have to stay in the clinic too long. So right now in Korea, there is no clinic that use Ultra-Reformer 3 anymore. I'm sorry about that. But however, now we've moved to the MPT like 5 years ago. So we have accumulated many cases with only MPT. So this is when I looked at the machine, I was so nostalgic. Well, there was a time I used that machine. So it's probably your time to use MPT. All right. So thank you for all the patients that listening to about the principle of HIFU and the new features of all new features of Ultra-Reformer MPT. Now this is time for me to share the clinical cases and my protocol to the patients. All right. So when we confront the patients, it's me in my clinic. We gotta check whether she has sagging area, whether she has a complex on her face, which part of she wants to get improvement, whether there is a decreased elasticity on the skin. After we check that, it's time for us to choose whether we're going to use MP mode, normal mode, or both. And we can even recommend the patient with the dark color, the DSP ampoule. Oh, sorry about that. Here, let's see. Alright, so after we choose MP mode or normal mode to use, we got a mark on the patient's face. So this is my actual drawing on her. So the most complaints that patients complain is that there is deflated area on our face, right? All the patients do not want to go over that part. Because as the muscle layer goes up, it looks more deflated if we go over the part. That's the reason I draw this like a line so I don't go over the part. If that area is too deep, sometimes I don't even go over that even a single shot. So the reason I put this picture on this lecture is that it is getting more important to have a knowledge of the flat pads. Because in Korea right now, a lot of teenagers, 20s, 30s patients want to look like an idol. Like idols are really, really super skinny, right? So it is my goal to get rid of the chubby fat on their face in 20s or for teenagers. So it is always good to know the anatomy of the fat pads. All right, let's look at the first case. So she's 21 years old. Have you ever gotten a patient in 20s, like this early 20s? Let me be honest. Recently, more than 40% of my patients are 20s. Can you believe this? For just lifting, 40%. I see 70 patients every single day, 7 days a week in Gangnam, in the center of the K-beauty and K-pop. More than 40% are 20s and early 30s. They came to the clinic because they want to look like an idol, look like an actress. They don't like, they want to prevent the line that they're going to have. So she will be my first case. When she came to the clinic, she was really worried that she's getting fat, and she wanted to look more slimmer. So I use 100% MP mode with Ultraformer MPT. I use. Let's look at the, you guys can video this anytime, so I prepared this for you. So I started with a 4.5mm tip with 0.7 joule energy. So I'm gonna contour the lateral temporal cheek fat and prevent the jawline sagging for her. I took this video at midnight. So she's getting a 1,000 shots technique therapy right now. So I start from bottom to the up side. So I'm trying to do against the gravity. So the vector should be from here to up here. So I'm using 3.0mm with a 4.4 joules. So I don't know how you guys actually are having adjusting the level, but 0.7 and 0.4 is my favorite. So with the 3.0mm tip, I contour the mid face and then try to fix the nasolabial fold and the Maryland line. And what I'm talking to the patient is, I'm always checking the pain level with the patient. Are you hurting? Are you okay? Do you feel alright? Do you feel a lot of heat? Whether she has a lot of pain during the procedure. So when you go over a chin, I lower the energy level a little bit because it's a little more pain sensitive when we go over the double chin line. And it is always good to attach the transducer on the patient's skin really well. If the transducer is a little apart from the skin, it's always the dangerous. That's always the dangerous point that we might get a burn on the patient's face. So this is the last part. So I use 4.5, 3.0, and this will be, I'm going to use a 1.5 booster tip with DSP ampoule. DSP ampoule contains again niacinamide, glutathione, a lot of amino acids that can brighten and tone up the skin. So this ampoule we just applied on the face. The standard will be 0.1 joules, but I'm gonna use 0.2 joules. This is for a fine wrinkle and eyebrow lifting, and it is really helpful for pore tightening. So whenever you use a laser therapy to the patient, you always can recommend this booster tip to the patient. Alright, so let's see the result. As you can see, before the treatment, she had some problem with nasolabial fold, marionette line, Indian line. She has a lot of fat on her chin. But by just one treatment with DSP ampoule and boosters, we can find out that her face got toned up. I never used the Photoshop. She was really satisfied with this result. Actually, this is telling us that how effective the MPT machine is for younger people also. Not only the 40s or 50s who already need intensive lifting. If you see these pictures, you can see that the coloration has gotten much better and skin looks more glossy. And the reason I brought her for the first case is that she is actually half Korean and half Thai. So her skin color is a little darker than average Korean, however, her skin got toned up. Alright, the second case is a male case. He's the one who's getting a laser treatment with me for a few months. However, even he's getting a laser treatment, he was always worried about his pores around his nose. So I recommended the Volnewmer booster tip. On the top of that, he had a pretty deep line on the nasolabial fold and marionette line. So I applied 3.0mm transducer on him. So the same thing. So I'm gonna contour the mid-face with 4.5 tips. Always check the pain level. And then we have to improve the nasolabial fold for him. So in his case, since the guys have like thicker face skins, we can use 4.5 tips to improve the nasolabial fold, not only 3.0. So as you can see this arrow, I'm going from down here to up here. Always keep this vector. However, when I use 3.0 tip, it doesn't have to have a specific directions. As long as it goes over the marionette line and nasolabial fold, it's fine. And then try to use at least 0.4 joules, because it's always my protocol, and always keep in mind that more energy results in a better effect. As long as the patient can hold the energy and then hold the pain. And then always just be careful when you use MPT that you're going to have a burn. But however, during many years I haven't had a single case. So for me, because we wanted pore tightening, I used the DSP ampoule and the booster pen type 2. So I have used about 500, 300, and 200 divided. So there is a lot of options for you guys to choose, because there is numerous depth booster and transducers that ultraformer MPT can provide. Yeah, so he needs to fix his marionette line. That's why I'm using this booster tip on his marionette line. Alright, so after the result, as you can see, even though his face was really toned up, it got toned up again. He might be white someday. Alright, so he was really satisfied with this protocol, because his dark circles got better, and then his marionette line especially gotten a lot better. So he had experience with 300 shots or 600 shots of MPT before, but he never had the effect like this before he started the 1000 shots technique. Which it means that we need to go over certain amount of energy, certain amount of heat to making this much effect. So 300 shots and 600 shots might not be enough for especially man's face. Alright, so the 1000 shots case 3 will be 35 years old male, recently in Korea. a lot of male come to our clinic to fix their face. Do you know why? Because in Korea right now, a lot of people already know that appearance is actually directly related to the social success. So he was really worried that he looks old compared to the colleagues in his company. And his BMI index was about 30 to 31, so he's kind of obese. So he wants to slim his face out. So I recommended a diet with him. I made a prescription. So I tried to use 0.7 joules for him too. But however, I had to lower the energy to 0.5 joules because he was really pain sensitive. And this is why you have to communicate with the patient during the procedure every single time. If you don't do that, you will break the rapport with your patient and he will never come back to you because he thinks this treatment is scary and it's painful and it can be traumatic to some people. So I always communicate with the patient during the procedure, and that's the beauty of ultra-former MPT, because some old therapy or other HIFU machine, we might have to put patients in sleep, so we cannot communicate with them. So better than 3.0 millimeter, he has a lot of fat and thick skin. 4.5 showed much better effect. However, it is always better to fix the Marion line and nasolabial fold with 3.0 tip. So even though it's gonna be like 100 shots or less, I always try to use 3.0 shots for the patients because patient wants a new experience for a new cavity also. So for him, I also use the DSP ampoule for him. So with the 1.5 booster tips, we try to fix the forehead wrinkle for him and globular wrinkle improvement. Show the globular wrinkle improvement. You can treat the eye bags, and then you can go over to the forehead, as you can see the arrow. So I use this booster tip like this line. So after the treatment, he got a lot of improvement. He was really satisfied and then made 3 more appointments every single month, 1,000 techniques. So as you can see, his nasolabial fold got much better. And then since ever I used the DSP ampoule, his tone got really up, and then we can see the glossy skin on his face. So he was really satisfied how the nasolabial fold and Marion line got better, and then he got a lot of compliments when he went back to his company that guys thought, wow, you gotta lose weight. How did you lose weight in so quick time? And but he didn't tell the truth to the colleagues. Alright, so ultra-former MPT, we're done with that. Now we're gonna introduce a new machine, Volnewmer. So if ultra-former MPT was a HIFU machine, Volnewmer is an RF machine. You guys have used RF machines, right? Recently, the reason I brought this Volnewmer to this topic is that recently in Korea, not only HIFU, for pre-rejuvenation and rejuvenation in 40s and 50s, RF machines are uprising. So compared to the HIFU machine, the goal depth of RF machine is different. Goal depth of RF machine is under 3 millimeter. And we're gonna reach only from 40 to 60 degrees Celsius, which is the best to make a collagen genesis. So once the RF hits the skin layer, it immediately cleaves the hydrogen bond of the triple helix, causing the shortening and thickening of collagen fibers. And it initiates the wound healing cascade from 3 weeks to 6 months. So using a Volnewmer, we're gonna make a thermal gradient effect up to from 40 degrees Celsius to 60 degrees Celsius, which is really good to regenerate the collagen. So Volnewmer has choose 6.78 megahertz, which is really safe and convenient as a medical device. And then this table demonstrates that RF machine was really effective for papillodermis and reticulodermis both. So we're doctors, so we want to look at the histology, right? So after treatment, 4 months later, after RF treatment, we could see epidermal thickening and an increased density of the skin layer. This also shows that RF machine has an effect of making a collagen type 1 and collagen type 3 increase. Alright, so those are beautiful ladies. Those are models and famous actors for those RF machines. They're not 20s. There is a reason that all these machines have choose the models who's not 20s. So Thermage, as you know, really famous. Oligio, Tentherma, Volnewmer, Density. There's whole tons of RF machines. And surprisingly, I have all of them. I have used them every single day for every time, like more than 600 shots. And then I brought Volnewmer here. And let me tell you why. So even though I have all of those, it's always comfortable for me to use Volnewmer because this is the only machine that has continuous mode with a repeat mode, with a curved tip, and this is the only machine that has water cooling system, not a gas cooling. This is a monopole machine, really effective the penetration depths also, just like Thermage or Oligio Tentherma. But the reason I like the Volnewmer is that Volnewmer was invented, and when they were invented, they started differently. They didn't copy the other machines, conventional gas cooling systems. They choose the water cooling. They choose the gold tip. This is the only machine that has gold tip, and we all know the gold is more effective as a transducer of the heat. And thanks to the curved tip surface and tilting tip head, we are not missing a single spot on their face when we treat the patient. So just like an MPT, I have chosen 3 important features of Volnewmer. As I told you, it is selecting the water cooling system, which is much more stable and safe for the patient. Shows an immediate effect with a good cooling effect with a short amount of time. So company class is a little crazy about having a small pain in a short amount of treatment time. I like that. So compared to the burst gas cooling, continuous water cooling has an effect that it reduces the accident of burns on the patient's face. But as a stand doctors, you guys know that even though this machine has great effect, I don't want to use this if this has a possibility of burns, and we can think that this machine can harm the patient, right? So continuous long-term effect given by a Volnewmer, it is really safe, showing an immediate effect with this gold tip. On the top of that, it has a tilting head of tip and with a curved area, so we do not miss the patient's face. And then it's really effective to treat the patient with this curved tip. Alright, and then this one is the only machine among the RF machine that has repeat mode. So the patient, not only patient, the physicians are really comfortable with using this. So those are the Volnewmer key features. I'm not going to go long for this because today's main lecture is about the ultraformer MPT. So this is made with a water cooling with the gold tip surface, and due to the curved and tilted head with repeat mode, it is really physician friendly. And a lot of you guys are not familiar with this Volnewmer, so I brought these clinical cases. So he's a 60 years old male. He got a sagging face on his double chin area, nasolabial fold, marionette line. So as the first look, and when I saw him, I tried to convince him and recommend 600 shot protocol for Volnewmer, only with the V tip. I didn't have to change I didn't have to change the tip. So you guys probably never seen this Volnewmer treatment before, so feel free to videotape it when to prepare the time you guys buy Volnewmer. So this is the RF machine, so it is really important to stack the head on the skin. So for the first stacking line operation I try to go over the same spot only 50 to 30% together. So it's gonna make the stacking a little more better.
말씀하세요. 움직이지 마세요.
So I'm talking to him that try not to move. Even though the video can be boring, it is really good for you to watch it really carefully because as you can see, I'm not going over too much. But at the same time, I'm going over a little bit. So 30 to 50% for first stacking. So now it's time for me to go over second stacking. So overlapping will be 0 to 20% only. So I'm moving faster, right? So this is how I'm stacking the heat on patient's face. So I hope there is a chance that I can introduce a Volnewmer a little more details, but I'm using a level 3 with the Q cooling on with the vibration second level. Right? So when the stacking is done, the patient might feel the pain because the heat is stacked a lot. That's the time I try to use a rolling technique. So if you do that, the rolling technique, since this is the only machine that can use this because we are selecting the water cooling system. So if I roll this handpiece, patients feel less pain. However, we can deliver a lot amount of energy while lowering the pain to the patients. So we have to check the impedance check always when we change the spots on the face because as you know, the skin layer on the forehead is a little thinner compared to the chin. However, Volnewmer has a really nice technique that automatically senses the impedance, so you don't have to worry about the skin layer differences among the face. So look at this result. He was really satisfied and I can confidently tell you that he will come back to the clinic for sure next or 3 months later because as you can see the nasolabial fold and mandibular line got much better and look at his tone. His tone got much better even though we didn't use DSVM for like HIFU. Look at this line, elected, the tone got much better. So not only bringing a male case, I brought 57 years old female case. I used 800 shots for her because her eye lines, as you can see, her eye lines were much more sagged and then she needed to fix the fine wrinkles around his periorbital area. So I used the green one and pink one. Pink one is for 4.0, full face and body valuable, and this is only for eye. So I use the eye tip around the periorbital area and then I use the V tip for full face. It's the same. Always check the impedance first and then I'm going to go to the stacking procedure start. So as I told you, first stacking should be go over about 30 to 50%. I try to use at least level 3 for Volnewmer to drag out the best effect without burning her face, but I haven't had a single case of burn with using Volnewmer, which can be really advantageous for you guys too, because I use this machine at least 6,000 V-tip shots, so 10 patients a day. So just like the previous case, I'm using a rolling technique now because she said, it's really getting hot and I feel the pain. As soon as you communicate with the patient, you can change the procedure from stacking to the rolling. It is very important to check the status of the patient and the patch. And the last one, after we stack the amount of the heat, I try to use the eye tip to fix the fine wrinkles around her eyes. I used the 1.5 level because the skin on the periorbital area is thinner, so level has to go down. However, the area of eye tip is really small, So if you use vibration, it might be a little dangerous to hold it really tight. So I do not use a vibration on this side. So if you took a photo of this, I will go to the next page. Alright, so as you can see on her face got much better on nasolabial fold and the Marian line also. On the top of that, we can see that her face got much more glossy. She liked the result also, and then she reported that she's getting more effect after a month and 2 months. So she has scheduled the clinic on August for the second session. Alright, well, thank you so much for today. Thank you for attention.